All right, good evening, everyone. I'm Richie Rasek, the Assistant Managing Editor at the Record Journal, here to welcome you to another one of our community conversation series. Tonight, we'll be having a panel discussion moderated by health equity reporter Chris Vivoni on the topic of asthma. Our panelists on the call are Stephanie Denya from the City of Meriden Associate Health Director, Marie Christine Bournaki, State Department of Public Health Asthma Program Coordinator, and Veronica Mansfield, Manager of Clinical Practice at Middlesex Health Center for Chronic Care Management. Thank you all for joining us tonight. If you have questions for the panelists as you're watching along, feel free to drop them in the comments area. I'll be monitoring the comments and we'll chime in periodically if questions come in from viewers. But otherwise, with that, I'll turn things over to Chris to get the conversation started.
Hi, everyone. I'm Chris. Thank you for being with us today. And I'm very excited for this panel. Well, to get this started, Veronica, could you give us like a rundown of what asthma is and how it sometimes manifests?
Sure. Asthma is a chronic inflammation in the lungs. It can really manifest at any age. But it is the most common chronic disease of children. And the most common symptoms that children or adults have when they present to their healthcare provider's office are coughing, a persistent cough, wheezing or whistling when they're trying to breathe, chest discomfort or chest tightness, and just shortness of breath. They may be ill with a virus or flu or upper respiratory infection, or they may have these symptoms regardless of illness.
And what are some of the first signs, especially in children? Because I know that they can develop very young.
Sometimes children tend to develop asthma if they're a family history, their mother or father has asthma or another sibling. When they're very young, usually in infancy or toddler, if they've had a respiratory virus, one that people hear about, RSV, sometimes that what happens is they have changes within their lungs and they develop persistent long cough, wheezing, or difficulty breathing following any cold symptoms following that.
And I want to pose this for everyone, but I guess what increases the chances of developing asthma? Is it environment? Is it genetics? It's just for everyone.
I guess I could start. I think that it is a combination of everything. That genetics, as I said prior, that there's a family history, there's a more of a chance of developing it. Sometimes if children were born early, prematurity, they can tend to develop asthma. If they live in a house with people who smoke, they're more apt to develop asthma. And then I know there are also many environmental factors that maybe Marie would like to chime in on some of our Connecticut information.
Hi, good evening, everyone. Yes, there are multiple factors that can make your asthma symptoms worse. So it's important to know what, when you have asthma, to know what seem to be the things that make your asthma worse, because it's not always obvious. And so in the home, for instance, as Veronica mentioned, certainly exposure to smoking is a big factor. And others include exposure to mold, exposure to dust, in a house where, there are also lack of ventilation. For instance, when you're cooking over a gas stove and there's no ventilation, that could be also something that could be, accumulating in the air. We're talking about air quality. So exposure to chemicals, exposure to scents, exposure to pets, pet dander, and obviously roaches and mice also are certainly triggers that you can, be exposed to in a home. I think I covered pretty much indoors, but obviously there's outdoor. You can be allergic to pollen. And with climate change, we've been seeing that the seasons for pollen are extended. So one may be more exposed for a longer period of time to pollen. And if you're allergic, and again, that's critical when you have asthma, is to be able to have allergy testing so that you know what you're allergic to before you make any big changes in your house. And so that's critical. So basically the idea is that once outdoors, we all know that for air quality, heat, extreme heat, humidity, high pollen index, and can affect somebody's respiratory system and is bad for everybody, right? So it's not just for those with asthma. But those are pretty much the triggers. There are other kinds of triggers too. Some people are more when they might be stress and emotional stress, or even as there are some emotional conditions that can trigger also some asthma. And some people, for example, have been triggered by having been scared or having had sudden reactions and so some of these components have been also reported as triggers as well.
I wanted to add and concur with what they've just said, as equally seen here in the school system. Another trigger that we're seeing, in addition to the weather, has been sports. A lot of students who play sports, have gym activities, will need to use their inhaler prior to, because that activity can certainly trigger asthma symptoms. So I just wanted to add that in.
Thank you. There's so many, I guess, how do people start understanding their own asthma, and how can parents understand their kids' asthmas? Because that is a very scary time to get a diagnosis suddenly.
I think one way to understand what is going on is to monitor your symptoms and really writing down when you go to the doctor, if they give you the original, what they call the emergency inhaler, the albuterol, or the nebulizer, really keep a track of how frequently your child is needing to use it because of symptoms. By doing that, that can help the healthcare provider know if you need additional medications, additional treatments, which is really important. And as you continue to understand and continue to use the medications, one key piece I think that people don't take enough opportunity is the education. People, there are educational programs throughout the state, and people don't take advantage of getting that information so that they can identify what their triggers are, how to avoid the triggers, as well as treat their asthma correctly according to their asthma treatment plans.
Yeah,
I agree. Yeah, sorry. I was gonna say I agree, and education I think is the key. In addition to collaboration, the school nurse does a lot of that education. She will work collaboratively with the child's pulmonologist, in addition to working with the families and, most importantly, the child. We also have a program through the health departments called Putting on Airs. It will assist parents in identifying what those triggers may be in the home. So the physician can make that referral, parents can give us a call, or even the school nurse. So if we're seeing that the asthma is not in control, they can make that referral to us. We will go out and do that home assessment and collaborate with them to provide additional education and eliminate any of those stressors that may be exacerbating the asthma.
Yeah, that was actually a perfect segue because I wanted to speak on education. I guess where can people find those sources? I know school nurses are a big source, but where are other people? Where can parents find that information to help educate their own kids as well?
I think, as Stephanie said, several of the health departments and health systems provide the Putting on Airs program in the home, as well as some outpatient education in the schools, in the provider offices through the health systems directly. That is probably the easiest way, even just to talk to their primary care provider or the school, because the adults need the education just as much. They go to the emergency room just as children miss school, adults miss work, which again is, very impactful in your loss of your ability to work, or, whether it's for you or your kids, missing school or daycare.
Yeah, it's interesting to see the kind of ripple effects of asthma, just to this miss school days, to miss education, and then work as well. I think, where can parents find resources to also help themselves, because I know that can be a big stressor on them. Where can people, I guess, turn to?
Yes. Well, I think that the Department of Public Health has many resources, on their site, and can help direct people as well. And I'll turn it over to Marie so she can answer those now that she's back.
Yes, I'm going to ask you to repeat your question, please.
Yeah, I was just wondering what resources parents can rely on to take care of themselves during this, because there's so many impacts of having asthma.
So education is key. And I think that knowing is power. So knowing, again, as Veronica stated earlier, is to know, to be able to identify what may be triggering your child's asthma, and also tracking when given a medication, are these effective? And so that's, a conversation to have with the provider. But as far as information, there are so many national websites, and we on our website use a great deal of information from other sources as well. And there are lots of novelty, and the language it's been made to be user-friendly as well. So there are programs for children. If you want to educate your child, there are children books that you can download and read to your children. There are videos that you can use also for children. There are a great deal of information that can help understand asthma and how it affects your life, and what you can do to make sure that asthma does not control your life, and to take charge of that. Empowering children, helping children understand that, to learn, to be responsible for their asthma as well, in terms of what are the things that we can be careful of. Let's check out the weather before we go out. And if it's not a good time to go outside, perhaps we can wait a little bit later in the day, when the air quality is better, and we can go and to the park and play. So, I think it's a question of understanding, having the knowledge and to reach out to all these sources that are available, whether it is to check the air quality, or again, to read some information about medications, whether it's about to read what's in a house that could potentially be a trigger, and there are, you know, community resources as well to help out, and I'm sure perhaps Stephanie can address that from a public health point of view in the community. But you know, especially when one is a tenant, obviously it may not be easy to get rid of some of the triggers, and so that involves, you know, communication with your, you know, tenant, your landlord or property owner, and certainly accessing the resources that the local health department might be able to provide you with and guidance. So I don't know if I've addressed that, but
I would agree. I had mentioned before about the Putting on Airs program. We do receive referrals from physicians. We also have parents who do call us, many of them frustrated with their landlords. And we do our best to work with the landlords and the parents and the child. The child definitely, as well as the parents, receive additional education and information, again, from the school nurse. She's a great resource. They spend, even though it's definitely very busy in those health offices, but they will spend as much time as they need to with the students, educating them from how important it is to utilize that inhaler and using a spacer so that the medication will effectively reach the lungs and improve their asthmatic situation. So definitely reaching out. I encourage parents to give us a call, and we will actually make a home visit. And there are different steps that we can help and resources that we can provide to them that will help eliminate, again, some of those triggers within the home.
What are some quick tips to have a trigger-free home, which I know is almost impossible to have a trigger-free home? So what can people do in the meantime, especially if it's a situation where they have to deal with the landlord and all of that?
We've advised parents just in some of the homes that we've gone into. You know, parents are always trying to get rid of, let's say it's from the cats or from the dogs, who light candles. And when in fact, some of those candles, which are great smelling, can actually also be additional triggers for the children. They will oftentimes, when we go there, they'll be cleaning with solutions. Some of those solutions could be bleach or a strong, again, very, very nice smell, but again, can be a significant trigger for the child breathing that in. We advise that if parents do smoke, it's a difficult thing, obviously, to try to stop doing. We will recommend that they go to smoking cessation classes. However, that may not be something that they're willing to do. So the recommendation is to smoke outside and to remove their coat or clothing that contains the smoke smell. That will eliminate any triggers if the child goes to give them a hug, etc. If there's animals, just maintaining litter boxes, ensuring those are cleaned out, especially even with the birds. There's people have birds and ferrets, just making sure that where they're residing is maintained and cleaned thoroughly often. Trying to think of anything else, but those are the type. And as far as dust goes, dust, I forget what they're actually called because I'm on the spot here, but they're mattress covers that prevent the dust, and changing those sheets frequently, dusting underneath their beds, things that we sometimes forget about, but need to be done in order to ensure that they're breathing that clean air.
I think a couple of other things that, just to add to what Stephanie is saying, is that people buy, again, because they're trying to get rid of an odor, like those plug-in air fresheners. I just tell people, I'm not going to ask you to spend a lot of money, just take them out. Because again, you don't realize it, it doesn't smell terrible, but it really could be one of those triggers that is just keeping that child coughing or having trouble at home versus when they're at school. If they have animals, some doctors may tell them you got to get rid of your cat, dog, etc. But we understand that's not easy to do. if you can keep the animal out of the child's bedroom. Depending on finances, if people have finances to get an air conditioner, I tell people 2 things that can really help with the moisture, the mold, is air conditioning for 2 things. One, it keeps it not too dry, not too moist, but also this time of year, people are having problems not only outdoors, but indoors, because you think you want to get the fresh air in. All of that stuff is blowing into your kitchen, your bedrooms, etc. So even if you can afford just 1 air conditioner in a bedroom, and if you do have a damp basement or a damp kitchen, a dehumidifier. You'll read online, but they'll sell you all kinds of air purifiers and this and that. Please, don't waste your money, but a purifier, an air conditioning and a dehumidifier, 2 key pieces. I find people can get those items.
And could you also speak towards the new medications? I've heard that there's some advancements in asthma treatment. Could you speak towards
Sure.
that and what's going on there?
Sure. So one thing I don't think we've spoken to, but it goes along with the medication component, is having an asthma treatment plan, which is something that is recommended for people of all ages. And we've always had them like a red, yellow, and green. So green means that you're doing well, and you will just have your maintenance medication, which might include daily medication. It may not, might include allergy medication, or it may just include albuterol before exercise. There's a yellow zone, and that is when people of any age are having symptoms. They start getting a cold, they start wheezing, they start coughing at night. That's a big trigger that it's asthma, and it's something else if they're just coughing at night. And when that triggers, that's when we want to start your rescue and your rescue plan, your rescue medication, which may be albuterol, or it may be the newer therapy I'll talk about in a minute, and continuing to use your daily medications if you're on it. And then the red zone is your emergency zone, where the medication isn't helping. You're really short of breath. You're breathing very rapidly. Sometimes if you're old enough to talk, you can't speak in a complete sentence. That's what people go to the emergency room. And we're working towards less and less of that if you're managing your asthma. So there are different categories of medications. One is the rescue inhaler, which is usually an albuterol or levalbuterol or Atrovent, ipratropium. Those are the short-acting that if you're having a cough and you take some puffs of that or take a nebulizer treatment, that helps to relax and open your airways. That is the way I can tell people. It's like if you have a fever because you have an ear infection, you take Tylenol, the fever comes down, but if you don't get the antibiotic, it's going to keep coming back. So those are the rescue medications. And then the most common asthma medications are inhaled corticosteroids, and they can be in a nebulizer form for infants, very young children, or they can be in different inhaler forms. And their common name of some of the medications are Flovent, Qvar, Aspex. Those are inhaled steroids alone. And then we have combination therapy, which contain an inhaled steroid and a long-acting albuterol. And these can be used, 2 of them, what we call Symbicort and Dulera, can be used for older children and adults as both their daily inhalers if they need them daily, as well as a rescue inhaler for their sick plan. That's new as of about 2-3 years ago. And then I'll just touch briefly on the newer medications. And these are usually for people with severe asthma that cannot be well controlled on the inhaled medications. Those medications are injectable. They have two that are for children that you might see on advertised, and those are usually for children who have pretty severe eczema, allergies, as well as asthma. And the inhaled medications are not controlling their asthma, so they keep going back to the emergency room despite the child and family doing everything correctly. And then there's also some other inhaled injectable medications for adults.
And what are the ways that asthma changes over the years? Because I know that it can change as somebody grows up.
Well, I think that is one of the challenges with it, because if you think of it like, a child who has diabetes, they're going to need insulin their entire life. The treatments can change, but it's not something that's going to be stopped. Asthma is one of those perplexing chronic diseases that there are times when people have symptoms quite frequently, and there's going to the doctor and having to get medication adjustments and taking daily inhalers. And then other times where children hit puberty, young adulthood, and they really have minimal symptoms. Not to say that they get a virus, they get sick, they move into an area where there's something triggering them, whether they get a job in a certain place, and then asthma symptoms can return. But we don't say it's ever gone away. It may be minimal. People may have minimal symptoms as they grow up versus when they were school-age child, but it does change a little bit over time.
And Stephanie, could you speak towards the importance of asthma action plans in schools and the communication between nurses, the primary care, and the parents and the kids as well, because that's important.
Very important. What's interesting is COVID really changed things for us in the school setting with asthma. And it was really about protecting the asthmatics from COVID, obviously. And a lot of students stayed home when they were ill. As far as the action plans go that went along with that, it has two changed for us. When we love action plans, but we like them to be current, as far as something that we get in, say, August, and then the child develops an issue in January, that's a problem. We are finding that children aren't being seen by their pulmonologist. So after speaking to several pulmonologists up at Connecticut Children's and Yale, I've requested that basically if the child is that sick where they need additional medication or more often, they really need to be seen by their physician, whether it be the pulmonologist or their pediatrician, just to make sure that they're following through what they need to be following through with, and that it's not something more to the point, where they get sick enough they have to go to the emergency room. That hasn't, some people had said, oh, that's going to create a problem. It really hasn't. I'm finding that more and more parents are working with us to collaborate with those pulmonologists and have their children see them when it is necessary. What we're finding is that's a decrease in the emergency room visits and actually better controlled asthma.
Yeah, because that collaboration is so important to address it. And how often should somebody be updating their action plans?
It's required. So medication, if a child has asthma, the medications, and if they're required in school for their rescue inhalers, for whatever it is, most of ours are for gym activities or for sports, but they're yearly. So those medication orders are only good for the school year. and need to be updated every August when the students go back to school. And it would be hopeful that they're also seeing their physician or pulmonologist on a yearly basis to evaluate how they are doing overall medically and physically. So to answer as far as the questions for action plans, again, we will not take them unless it's a current issue that we're working on, because it's important for the child to follow up with their physician or pulmonologist to determine what's the best course of action at that point, because there are so many new medications out. The pulmonologists are actually quite happy with that.
Can I just say that the national guidelines recommend that children who have intermittent asthma see their provider at least annually. If you have been hospitalized or children have more persistent symptoms, that they should be seen every 3 months. And if you have severe asthma, really every 1 to 3 months, regardless of if there's a change in therapy or not. That is recommended, more visits, not less. I think we did get into, the problem during COVID with a lot of things that people didn't go for their regular checkups. So that also played a part in it.
Exactly. And I think that's where the pulmonologist I spoke with up at Connecticut Children's, I think that's the big concern as well, that there was not a lot of follow-up, and this is definitely encouraging those parents to seek out that medical attention for their child when they're in that need.
Yeah, especially as we said that asthma can change. It won't go away, but it'll change and develop. Is there a way to update the action plan throughout the year in case something does come up like that?
Well, I think, having a generic action plan on hand, once we have an order on hand, because that's considered orders from a physician, we can never give medication without those specific orders as nurses. I think having an action plan specific with a start and end date for that child, because they're going to need that medication more often. For example, albuterol, which is a rescue inhaler and may only be prescribed for 20 minutes before gym, may now all of a sudden need to be given every 3 hours and not as needed. So those orders really need to be updated per incident. We can't, if the parent calls us and said, oh, little Johnny needs his inhaler at noon. Well, our orders say that he needs it at noon only if he's wheezing, coughing, or short of breath. If the nurse makes that assessment at noon and does not find that, that's not something they can do unless they specifically have an order from that physician. So that's why it's really imperative to have that good communication between the physicians, the nurses, and the parents. We understand, the parents and the child the child knows his or her own body. So they know when they need their medication, when they're well educated. They know what the triggers are when they're well educated. So I think it's important for the child and the parent to have great communication with their school nurse, so that the school nurse could then speak to the parent, speak to the physician about what the best course of action may be at that moment. But the physician really needs to see that child if they're having some sort of an exacerbation. There's something not right.
And we spoke earlier that the outdoor air can be a really big trigger. Marie, could you speak on the resources available for air quality control? I know that there is a FLAG program as well. If you could speak to that a little bit.
Yes, of course, I'm happy to do so. Again, it's a question of how do we know, and that the air quality is perhaps putting us as at greater risk for having asthma symptoms, is again, there is a way. The Environmental Protection Agency has promoted a way to inform the public by using a flag system. And the flag has different colors accordingly to the air quality index. And of course, the idea is to be able, as a resident, to be able to, when you see that flag, that you understand, depending on the color, where which means, if the air quality is going to be good or not so good. And, so the idea is to disseminate the information by using a visual. Obviously, the most accurate information is to go on your iPhone or your, computer and check out Air Connecticut Now. So you'll have all the information, plus you'll have specific information about the pollen index as well. And I think that those are the, but there are also, a lot of policies that need to be, that have been put forth to reduce, for example, bus idling near schools, and or cars as well idling. As a matter of fact, I just have a quick story, because yesterday I listened to a presentation from Wisconsin where I thought it was very interesting. This school made a project to get some sensors and to, in the morning when all the cars and the buses are in, to measure, the air quality using their sensors, and at different times during the day. And when again pickup time that came back, it was again done, and they showcased that there was a lot of air pollutants at the times when children were dropped off and picked up. And again, I think that it brought awareness to the air pollution created by car emissions and so on. So I think that it's important to be aware of that, and I think there's a great deal of emphasis to reduce emissions, from the Environmental Protection, the Department of Environmental and Energy Protection. So they're doing a great deal of work with regards to tracking air pollutants, tracking particulates that are damaging. And we know, based on surveillance, that there seems to be a strong association based on high rates of asthma emergency department visits and areas where residents are exposed to high pollution. So I think that brings again the attention to implement monitor that, tracking that air pollution, but also put in some control strategies and to reduce those. It won't happen overnight, obviously, but I think that there's a great deal of efforts to put those strategies forward, and policies as well, modifying the way that we use transportation.
Yeah, I can imagine climate change is also a big factor into all of this and addressing that. And you said that for the flag programs, when somebody sees a flag, so they can act accordingly. What do you mean by that?
There was a time when they had multiple colors to indicate the level of air quality. So I'm just looking now at the Connecticut Air Now, where they're talking about the air program, the air flag program. And now they have 4 flags. So they have a flag that is green that says it's good, a red flag that says it's not good, it's unhealthy. And they have they have a yellow flag that says it's moderate and an orange flag that says it's unhealthy. So green is good, red is bad, orange is not good, and yellow is moderate. So at least they reduced it. They had 7. So can you imagine, remembering all these 7 colors? And I remember learning from that, but I'm pleased to see that it's 4. So I know that it's been implemented in some towns, I think in Connecticut, where I think communities and residents have been very pleased to see disseminating that information. Plus, it's also been a great tool to educate children, because it's asking sometimes in schools to, have a group of students who may be interested in, or who may be assigned to identify what is the air quality, and accordingly put up the flag and the right color that goes with it. And so when they put it up, and I think it's a great way to take action, children, adults, and be involved in that and disseminating that information. I think that I think it's wonderful. And I think that, again, empowering people with the information to know what is your area and air quality. And I think that as a citizen, we have a right to be able to ask for, the right to clean air. I think that everyone has that right, and efforts need to be put in place to fulfill that.
I also think it's interesting to have a program like that at a school, because then it helps. I mean, in an example of gym classes, I remember running outside a lot to do the pacer tests and all of that. So to have it in a school is really interesting, especially because it also gets the information out to parents as well.
Yes, and I think, I think that I'd like to perhaps ask Stephanie, and maybe she can share that, whether policies in school are available to inform coaches of, this is not a good day to run the mile, or maybe children shouldn't be going out, those who are known to be asthmatic, to go outside because the pollen index is so high that it's not healthy for them to be outside. So I'd be interested to hear from Stephanie if how they communicate with perhaps the coaches or phys ed teachers about that information.
I know there have been situations the last few years where the weather has been extremely, especially those really hot and muggy days. I know that's because I have direct communication with the assistant superintendent, especially in August when they're beginning their football training and soccer training and the outdoor track. So they will take every precaution they, possibly can, whether moving those practices indoors or starting very early in the morning when it's much cooler and it's not as difficult to breathe, or just canceling them altogether. So they are very in tune to that, especially they're in constant contact with the meteorologists and receive constant updates, as do I, indicating what is a good day, what is not a bad day, and moving forward from there. But they are very proactive, I can tell you that. If not, I'd be all over it.
No, yeah, that communication is really interesting, and to see the coaches really step up and be there for their students, to make sure that they feel comfortable and safe. What other things should people be watching out for, especially now that we're entering in the summer months? It's getting hotter. We're probably going to have another heat wave at some point. What should people be watching out for?
I think that people many times think that because their children are out of school, that maybe they don't need their daily inhalers because they're not around so many kids. There's not so many of the viral illnesses, things like that we saw this fall and winter. But just because it's July doesn't mean the asthma's gone away. That really, especially with these heat waves, we've got to keep up with our maintenance medications, allergy medications, your daily inhalers. People take the honeymoon, the summer off. That really, if they're considering that for whatever reason, they really should be in contact with their provider. Because, and then if you want to go to the beach, you want to go out in the heat, if you're not, asthma's not well controlled, that heat and humidity can be a big trigger for children or adults.
I would agree. I think what happens too is that, especially if a child has an order to use their inhaler 20 minutes before activities, and then they're home for the summer, for some reason, they forget they have that order in place and they don't use it when they're home. So I agree. It's really just reminding the parents that and the child that really needs to be maintained throughout the summer to control their asthma, keep it in control. And COVID is also not over, right? So always being very mindful that that COVID can occur at any time, as we know. Just being very mindful of taking care of ourselves, drinking plenty of fluids, maintaining an excellent diet regimen, and also physical activity. Just keeping your physical activity up, but also utilizing your medications as ordered by your doctor.
Yeah, it's interesting that it's that happens, because for me, I think that having the heat and all of that would make it more, oh, I need to have my inhaler around. So it's very interesting to see how that happens. What are other ways that people can stay cool? Because I know we brought up the ACs being a really helpful thing. So how can somebody, I guess, curve that if they don't have access to AC?
I think that it's important to know in your community where you can have access to, indoor, air-conditioned environments. And so if you're living in a place where it gets very hot and it's difficult for you to even stand the heat, I think that there are malls you can go to, or there might be some community centers where you might be able to go to where you would be comfortable. And it's probably safer to actually go there than to stay in the heat. Drink a lot. And I would say to everyone, check out on your neighbor to make sure everybody's doing okay during a heat wave, because it affects everybody, not just people with asthma.
I was going to add the library as well. Children have summer reading, right? What a great place to go and get your summer reading in and stay cool.
Yeah, the library is a great idea. That it's a great place to just to hang out. Well, we're getting close to the end. I think we're going to open it up to audience questions. Richie, is there anything?
No, there has not been any that came in over the chat, but I guess as we're heading into the home stretch, you guys, each of the panelists come, approaching asthma from a slightly different position. If we heard a lot of very interesting things today in the discussion, but from your perspective, if you had to give one takeaway that you wanted parents to know from this discussion about asthma, what would it be?
For me, it would definitely be collaboration on education with children and their families. I think that's key. If everybody is on the same page, everybody is working together. And when I say everybody, I mean the physicians, the parents, the child is the key factor there. The child has to be on board. We've taught children as young as kindergarten, my own child actually in kindergarten, on how to manage their asthma and know when those triggers, what can be triggering them. And then of course, the educational community, working with the teachers, working to know what what stressors are that might be in the classroom setting, to working with a school nurse. And all of those key people involved will help maintain the child in the school setting as well as at home, working with your health department as well.
I think the one thing that I would like to say is that it is not cured, but asthma can be controlled. It can be well controlled. Again, with the communication of working with your healthcare provider, keeping appointments with your providers, whether they're primary care or pulmonologists, even if your child is feeling well, that's, or yourself as an adult, because that is where I find that when people go to the hospital or have to bring their children to the hospital, oh, we stopped the daily medication because he'd been feeling so well, or I had been feeling so well, and not communicated that at all with their healthcare provider. So that would be a key takeaway, is following your plan of care, communicating with your regular doctor, so that, if you are feeling better, maybe they can back down on your medication or a lower dose, but they don't know that if there's no communication and regular follow-up care.
I would like to probably say to parents that align with Veronica, the asthma can be certainly controlled, but it will take effort, and it's important to have allies. And when you're, again, with everyone's advice to make sure that you're following your the medication, the prescribed regimen, and you follow up with your appointments, that's key. It's also key to make sure that at home you're aware of what might be, the things that might trigger your asthma, and if there's anything that needs to be worked on, and so, with your property manager or your landlord, it's key to really keep the channels of communications open and try to find, solutions that can help you. And of course, the last, use your local health departments as well to back you up. And as they can certainly provide you with assistance with regards to environmental triggers.
All right, and well, with no other questions from the audience, that's and we're coming up on the hour here. So I want to thank all of the panelists for being here today. I think I've learned quite a lot, and I hope that the audience did too. So yeah, just thank you so much for taking the time to be part of the conversation. And for everyone watching out there, let us know. You can drop it in the comments or go to myrecordjournal.com/voices if you have topics for future community conversations that you would like to see. So until then, be well, have a great rest of your evening.